Hello and welcome. Let's talk about eicosanoids prostaglandins. Now, what are eicosanoids? Eicosanoids are oxygenated products of the polyunsaturated long chain fatty acids. Eicosanoid means 20 carbon atoms fatty acid. The drugs include prostaglandins, thromboxanes, leukotrienes, and related compounds like lipoxin and 12-HETE. The source is ubiquitous in animal kingdom and variety of the plants together with precursor cells. Precursor is arachidonic acid which is most abundant. Now, it is highly potent, has 20 carbon atoms and acts in autocrine and paracrine fashion, an extraordinary wide spectrum of biologic activity and specific receptor and enzyme inhibitor. Now, this is a picture showing different eicosanoids and different action. Now, pharmacological effects. On CVS, it is a potent vasoconstrictors like thromboxane A2 and potent vasodilator like prostaglandin I2, prostaglandin E2. On heart, it reduces myocardial contractility and coronary blood flow. Coronary vasoconstriction is caused by lipoxin A and lipoxin B. On respiratory system, bronchoconstriction is caused by prostaglandin D2, F2 alpha, thromboxane A2, LTC4 and LTD. Bronchodilation by prostaglandin E2 and I2. There is increased bronchial secretion and increased microvascular permeability by LTC4 and LTD4 and increased plasma exudation. On GIT, there is contraction of the smooth muscle by prostaglandin E2, F2 alpha and I2 and leukotrienes. On renal system, it maintains autoregulation of the kidney by prostaglandin and leukotrienes. Increased renin release, increased glomerular filtration rate, and increased water and sodium excretion by prostaglandin E2 and prostaglandin I2. And the intrarenal vasoconstriction and ADH-like effects are caused by thromboxane A2. In case of platelets, the inhibition of the platelet aggregation is caused by prostaglandin D2 and I2, and stimulation of the platelet aggregation by thromboxane A2. On eye, there is a reduced intraocular pressure by prostaglandin E and prostaglandin F. On reproductive organs, in case of female, the increased uterine contraction is caused by prostaglandin F2 alpha and thromboxane A2. And uterine relaxation is caused by prostaglandin E2 and prostaglandin I2. In case of male, enhances perineal erection by relaxing the smooth muscle of the corpora cavernosa by prostaglandin E1. Now, in case of blood cells and inflammation condition, the potent chemoattractant for neuro, eosino and mono includes prostaglandin D2 and LTB4. The promotion of the eosinophil adherence, degranulation and oxygen radical formation by LTC4 and LTD4. The inhibition of the lymphocytic functions and immune response is caused by prostaglandins, and the inhibition on differentiation of the beta lymphocytes into plasma cell and inhibition of the human antibody formation prostaglandin E2, and reduced proliferation of the T lymphocytes and reduced release of the lymphocytes by prostaglandin E2, and activation of the monocytes and macrophages by lipoxins, and inhibition of the eosinophil and lymphocytes by lipoxins. Now, in bone metabolism, there is increased bone turnover, so increased bone resorption and formation caused by prostaglandin and may mediate the effects of the mechanical force and changes in the bone during inflammation by prostaglandin and may contribute to bone loss in menopause. In case of fever, there is increased body temperature by prostaglandin E2, F2 alpha and I2. It induces normal sleep by prostaglandin D2, and neurotransmission includes increase in the pain, where there is inhibition of the release of the norepinephrine from prostaglandin glutamic sympathetic nerve ending by prostaglandin E, sensitization of the peripheral nerve ending to painful stimuli by PGE2 and I2, increased excitability in neuronal pain transmission pathway by prostaglandin E2, and hyperalgesia by LTB4. In case of neuroendocrine, there is increased release of the growth hormone prolactin, TSH, ACTH, FSH, and LH by PGE2, and in parturition, induction of the oxygen dependent decline in progesterone levels by prostaglandin F2, stimulation of the LHRH and LH secretion by LTC4 and LTD4, and stimulation of the release of the aldosterone by 12-HETE. Now, clinical uses includes L-prostadil for smooth muscle relaxant, maintenance of the patency of the ductus arteriosus for erectile dysfunction, misoprostol for cytoprotective prostaglandins used to prevent drug-induced peptic ulcer, dinoprostone is used for the induction of the liver, also used as abortifacient for abortion, menstrual regulation, early abortion, hereditary from mole, patency of the ductus arteriosus, prostaglandin E2 and F2 alpha for delivering intrauterine death, carboprost for abortifacient promotion of the liver through ripening of the cervix and control of postpartum hemorrhage. Ipoprostino is used in both primary and secondary pulmonary hypertension, and treprostinil is a long-acting pulmonary hypertension, Raynaud phenomenon, and peripheral atherosclerosis to maintain patency of the neurite ductus arteriosus. Latanoprost is topically used as drops, and stable long-acting is used for glaucoma. Now, inhibitors of eicosanoids. These include corticosteroids, NSAIDs, sulotroban, zirutone, and zafilukast and montelukast. End of the topic.